The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm the pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center and Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. This is our first show outside the studio that will be live on Facebook, and it's coming to you through the magic of Zoom. And our guest today is Dr. Margaret DeLillo Story, clinical counselor specializing in trauma and post-traumatic stress disorder and mental health counselor for Perry Local Schools. Dr. DeLillo Story, welcome to the show. Thanks for joining us, and we're looking forward to talking to you today.
Thank you, and thank you again for having me. I love this show.
All right. As the number of cases of COVID-19 increase, so does the associated anxiety for the general public. The mental health effects of COVID-19 are important to address and are the physical health effects. And for 1 in 5 who already have mental health conditions, or 1 in 2 who are at risk of developing them, we need to take personal, professional, and policy measures now to address them. This morning, we're going to talk with Dr. DeLillo Story and learn how to identify the name and emotions that we are experiencing and talk about how to best help each other. We'd like to remind our listeners that this program is available on our podcast, which can be downloaded from the App Store on the mobile phone. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have any questions you'd like addressed today, you can post them up on our Medicine Center Facebook feed, and we'll do our best to address them. And we hope you enjoy today's program.
So, Dr. DeLillo Story, welcome back. You've been on our program before. We're pleased to have you as our guest today. Tell us a little bit about yourself and your background.
Well, my name is Margaret. I am currently the district mental health counselor for Perry Local Schools, and I work with our trauma and resiliency collaboration through the Stark County Educational Service Center with a lot of remarkable folks throughout the community and within our educational realm. And I've been with Perry now. This is my 11th year. Prior to that, I was a member of the United States Armed Forces. I retired from the U.S. Army, combat war veteran, was in private practice with what's currently known now, whether it was NEOBH and a couple of other things, and now Lighthouse, Family Solutions, great organization, worked with many of our Stark County organizations in different ways. So it's kind of a little bit about what I do. I'm a mom, have 2 beautiful kids, married 25 years this August, and love our community. Try to stay pretty active on different boards and social organizations within Stark County.
So how many years in the military and where were you?
Well, my DD-214 reads 21 years, or 22 years, 11 months, and 23 days. It's real specific. I was a little bit of everywhere. I did boot camp at Fort Jackson, South Carolina, went on to San Antonio, Texas, was a combat medic to begin with, did some nuclear, biological, and chemical warfare after that, went into retention and personnel, then decided I was going to make it a career, so sent up my packet and I went all the way to VA, Washington, got boarded, got accepted, and attended Fort Benning School for Boys, and then was commissioned a second lieutenant in 1990, early 90, and deployed to Saudi Arabia for a year and come home June 3rd of 91, and the rest was history. So as an officer, I did some logistics, hospital logistics, plans, operations, and communications, and that's where I actually began the career transition into mental health. That was my plan, was to then become a military psychologist working with our returning war vets and their families.
Wow, that's amazing. So as a mental health counselor for Perry Schools, explain to us how the transition from school to home has affected family life.
You know, it's been a transition, not just in Perry, but for every school across, I believe, the world that's shut down and is doing education differently. I think one of the main things that's really important that we all realize is education has not stopped. Teachers have not quit teaching. Counselors aren't home chilling out. Administrators aren't on big family vacations. They're all doing what they do, but remotely, which adds layers upon layers. And so how it's affected is our homes have become everything. Our homes are our churches. They are our schools. They are our staycations. They are, our restaurants. They have become everything. And so it makes it a little bit difficult to get that little bit of a break. When you think about going to school, for students, that's their job. That's where they're going. That's where they're sitting. This is my place of education. There can be a separateness. For educators, this is my job. And then they can leave their job and go home. And this is my home and this is my family, et cetera. Right now, our homes or wherever it is we are residing for the stay put is everything. And so it's altered a daily routine for everybody involved, not just our students that are no longer sitting in a brick and mortar building, but for those folks that work in those brick and mortar buildings.
We've got a bunch of students out there. How do you stay connected with them, or are you connected with them when they're not in school?
That is, it's presented challenges. However, we are doing the best. We're doing exactly what we are doing right this minute. We're Zooming. We're making phone calls. Schools use, Hangouts, Google Hangouts. It's a challenge because everything is remote. And as human beings, remember, we're wired to connect. We're wired to relate. And part of that relating and part of that connecting is human contact. And, it's the hug, it's the pat on the shoulder, it's the you'll be okay. And right now what we have is our voices and our faces on screens to try to convey that same message that we're still here for you. We're still educating. We care. We're available for email, for communication, for contact, but it's all remote. And so although we're doing it, it's totally different and it looks different.
I was talking with a friend who has 3-4 children, and I thought that she said something that was somewhat monumental. She said, we don't know how to get along as a family.
Yeah.
Because they're all at home together, and they usually are out doing sports or school or whatever. I thought that was pretty profound.
It is. And when you think about that, it's a shift in the routine. We learn to function. When you have families or kids that are active, we learn to function a lot of the times based on their schedule. I have school at this time, then I'm staying after school for speech and debate or football or lacrosse or track or, choir or the plays. And so our schedules get that, it's like, I'm going to go home, I'm going to have dinner at this time, or we're going to get takeout, or we're going to do this, and then I got to run here and pick you up and come back. And in between time, we're going to try to get some homework done. And right now we're kind of all in the same space for extended period of times. And oftentimes your only break is, oh my gosh, it's time to go do the weekly, get the laundry soap, or we're getting takeout tonight to support a local business. That's your break.
Okay. So what resources are available if the kids are feeling depressed or frustrated or anxious or whatever?
A lot of the same resources are still available that were available when we were able to be out in public more frequently in lots of folks. We're very blessed in our community. We have, in the education world, we have the Stark County Educational Resource Center, which they have a ton of stuff posted for every educator to get on and access the website, which I will be happy to forward to all of you to put up for that as a resource for people tuning in or looking in. We also have, great resources with Patty Fetzer, who is our Director of Prevention with the Stark County Educational Resource Center, has put together a phenomenal resource on. Here are some different sites and links that families can access for how to enjoy time together, how to have conversations and games. Our Stark County Mental Health Addictions and Recovery Board, were, again, what a resource for this community. There, you can get on that and just see a plethora of what if for this. We're feeling this. And there are just links and phone numbers and emails and places to reach out to, things to access as a whole family or as the parent or as the student. So resources are there. Again, it's access that looks a little bit different, where we could maybe say, can I come in and talk to you? A student might sign up to see their counselor or share something in person with a teacher. They still can do that sharing. But for us in the educational world, in the counseling world, in the business world, it is remote. At home, they still can say, do you have a minute? And then that's a whole nother thing, is how do we make that minute? But the resources are there. They just look very different, again, as to how we access them. But they are there. And our folks are staying on top of putting the most current stuff available to families and kids and counselors and educators day to day.
Parents are not trained as teachers.
That's correct.
So how is this clicking in place?
Okay, so I think that's a really great question, because here's what, and this is going to probably sound cliche, and I'm probably going to get a lot of, oh my gosh, you must be old, but that's okay. Here's what I'm going to say. Parents are our first teachers, okay? So teaching your children should not be new or foreign. Here's where they're not experts, to include myself. I don't want to be a math teacher, okay? I don't want to be a history teacher. I don't want to teach you why molecular structures of this atom don't work well with that one, okay? That's where our teachers are just phenomenal, and that's where parents can rely on those adults that are teachers and that expertise. And so what's really happening, again, I think it's important to know, our teachers are still teaching, but kids are accessing their education in the home. So the parents' huge piece to that is making sure, helping to get that routine in place to help your kids access their educational time. And yes, with the wee ones, parents may be a little bit more hands-on with doing an activity or assisting their child with getting, but again, we have to realize there's a lot of mercy and grace given right now. And when I say that, teachers understand that, and parents are hopefully understanding that this is equally as new for our educators on how to deliver this. So I think that conversation via email or that phone call is crucial. Again, it goes to that connectivity and that staying connected to make the whole system work, because this is not just new for moms and dads. It's not just new for kids. It's new for pharmacists. How are we dispensing? How are we doing this? How are we meeting? It's new for our doctors and our nurses, our principals. Think about, how do our principals do what they need to be doing from a computer? So it's new for the nation, and we all just have to step back for a minute and say, you know what? This is new, and we do need to work with one another to make this whole education piece right now work. We have to work with one another to make it all work, or the system doesn't work.
Very interesting. You're listening to Health Matters with the Medicine Center Pharmacy. Let's take our first break here.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Margaret DeLillo Story, mental health counselor at Perry Schools. Have a question, posted on our live Facebook feed.
Okay.
You're back, Brad.
All right, Margaret, let's talk about how we're affecting our senior population in this environment. Can you speak to that?
Yeah, I think we have to, again, look at, I don't believe there's a population that is unscathed from this. I think there are populations we have to take some extra special care for, again, due to the risk factors involved. And it come out pretty early on when the virus began that our senior population, I believe they quantify that as like over 60. They're one of the more at-risk populations, and it's always been advisable from the very beginning that they limit social contact. If you have family members and friends who can assist with, being kind to a neighbor, if you're going to the store asking, is there anything you need? Again, to protect their physical health. So in doing that protecting of the physical health, how is that impacting their social contacts and well-being? And it wreaks havoc on them as well, because again, basically we look at, they're shut in, and there's a difference between feeling socially isolated and feeling depressed, because we can be depressed whether we're isolated or not. But if you're already feeling alone, if you're already by yourself, and now you're asking me not to go out, not to go to the store, not to shop for myself, how am I maintaining what I need to just stay emotionally and mentally well? And again, that's where we say you have to look for the things that you can do. Okay. Zoom calls, that face-to-face. I know that for my family, we started that being isolated. I'm going to tell you, I have a huge family. We've never Zoomed in our life. But since we've been isolated, we've sent emails and we schedule a time, whether it's a half an hour that my mom, my brothers and sisters, we get online and we can physically see each other. Now, we talk to each other or text during the day, but to physically lay eyes on, even though we can't reach out and hug, we can give an air hug or a viral hug or whatever we want to do. But for that population, it is crucial that we are being intentional about how we are communicating, and connecting with our senior population. And that might be a knock at the door and I'm going to wave to you and communicate through the window. That might be, I'm going to drop something off on your porch today. That might be, we can open the door and talk and stand 6 feet back just for that person to know you're not lost. We're still connected with you and we're thinking about you. So I do think being very intentional, especially with our seniors, it's crucial.
What about if you were receiving counseling services of any kind, really, how do you continue with those?
So all of our, let me rephrase that because there's never all and there's never none. So the majority of our counselors are doing the same thing that our medical professionals are doing. They're doing teledoc, some sort of telecounseling. Even us in the schools are connecting with our kids via class hangouts or Google Hangouts. And I'm probably saying it wrong because remember, I am not a tech person. And Zoom. So I know I'm meeting with teachers in their scheduled class time so that I can connect and have a conversation with kids. I know that our mental health professionals in private practice are doing the same thing. They'll call you, they set up the time, and then you're going to get that phone call. Now, it could be telecounseling, which means it's just you and your therapist having a phone call conversation. It could be via, we're going to talk while we're looking at each other. It's their choice, but it is happening and to connect. And I'm going to tell you, I hear the same thing. Half of them like it, half of them don't, and that's on both ends. But I would venture to say to you, when we're allowed to be in their offices, half of them like it and half of them don't. So, again, it's just different, but it is still accessible.
All right, I think it's time for our news break.
It is. It is the bottom of the hour, and it's time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The Half Off and Out by Store in Louisville is open. That's right. It's open, and it is really open. Usual hours. We've stocked up with necessary paper products, cough cold, vitamins, and many other healthcare products. We have a very safe environment with hand sanitizer and wipes for use at our entrance. And we also have a new acrylic screen to protect you at our cash register. We think we can fill most of your healthcare needs also, and our Medicine Center pharmacies all have efficient drive-through services for prescriptions and additional healthcare products.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing mental health tips during the pandemic. We've got a lot more to cover this morning, so let's get back to the show. So, I wanted to ask you another question.
Sure.
This subject that we were kind of kicking around earlier. How do we monitor the students? I hear from my grandchildren that we're doing a lot of homework. We got a busy day and all that kind of stuff. How do we know they're doing it?
Well, again, that's the beauty and the expertise of technology and our teachers and administrators being diligent remotely as they would if we were in a building. So homework isn't just sent over an email system and saying, hey, do this. It's done, and then it's sent back. Kind of like, if you will, the higher education institutions. When you do a college class online, you have scheduled Zoom times with those professors. You have work that needs to be done by a certain deadline and submitted, and it's graded and sent back to you. And our public ed systems are functioning in that same way. There is accountability. If we see that students aren't doing stuff or turning work in, then calls are made. We may, pop out to the home at that point to see if everything is okay. Because there are a lot of factors to consider when doing something like this worldwide. And it's, not everybody's blessed to have the internet service. Not everybody's blessed to be able to be home all day, every day. A lot of our kids come from families that have essential workers. Talk about shifting. So other things need to be put into place, and monitoring back and forth is, again, that's that connectedness, and that's that communication via email, phone calls, Zoom calls. So it's not just, here, I sent you this. It's turning in work, the same as if you were, again, in that brick and mortar building. If there's a deadline and we're turning in the work, they're submitting work, again, to the teachers, but remotely. And in some cases, with the ones that don't have, work is taken to the home in an envelope, and it's collected back and then taken to the school and given to those instructors, to the teachers.
Okay. So we talked a little bit earlier about family frustration, but is it normal, for families? Okay, most families aren't home all together hardly at all anymore, just in the evening. Now they're together all the time.
Oh, my gosh, yeah.
So how do we manage the frustration that comes about?
Well, again, this is where communication has to be key. I love my family with all my heart, but you know what? I sometimes need a break, and I don't feel wrong in saying that, and I'm positive they need a break from me. So one of the things we have to do is, it's the truth, I know it, because my kids are getting really good at it. In fact, I just posted it yesterday because it was sent to me, was I told my kids, your education has shifted. You're going to take a class now in AP floor scrubbing. We're going to take college prep classes in dishwashing. So they're almost a whole lot more, and we're going to do laundry 101. And so trying to make fun time.
So is your kids now know how to do the laundry, run the washing machine, the dryer, and all that stuff.
Absolutely. Yeah. And I'm hoping to get them onto other things in that way. But no, in seriousness, one of the things we have to do is, this is where you have to be mindful and respectful of one another, and that we all do not handle situations in the same way. I don't care how much you love your family. I don't care how much discord there is in your family. We are all individuals, and in this time right now, we are cohabitating under the same roof, and we have to figure out ways to make it work. And one of the best ways to make it work is to understand what's right for me may not be what's right for you. What I need may not be what you need. But if I don't communicate those things to you and you don't communicate those things for me, I have no clue. Because, I have many, many talents, but one of them is not mind reading. And so it's okay to say, you know what, at 5 o'clock, I'm taking a break. I'm going upstairs to my room and play. I don't want to be bothered by anybody. Or I'm stepping outside of the house and I'm going to go for a walk. And today I want to walk by myself. Or I just need 20 minutes of silence. So I'm going to put the headphones on and listen to what I want to listen to, whether that's, your kids' choice of music, or they want to get online and play a game or do something. We still have to find ways, just like when they were in school, they had those breaks from us and we had them from them. Right now, we don't have the luxury of their leaving the house. As I said earlier, everything is being done right now within the four walls of the house: church, school, home, everything. So we have to create spaces within our house and not be afraid to say, this is the new routine and this is how it's going to work. If you need your time out, you need to say at this time of the day, or put the hand up, or just say, I need a minute, and take that time. Otherwise, things get ugly quick. That's reality.
All right. I think you answered my next question without me asking it, so go ahead, Brad.
Which one is that?
Family members coping.
Each of us manage stress and anxiety in a different way.
Oh, yeah. And, again, it's what works for you. And what I always say to folks, even when we're not in this pandemic, is how do you normally, we'll get questions. People will say, you know what, we just lost a family member and so-and-so's not crying, or they don't seem to be. And one of the questions I always ask a family is, listen, how do they normally do this? How do you normally function? If you kind of are quiet anyhow, you're probably going to continue to be quiet. So what we're looking for are those extreme differences. And if your family's, we're loud Catholic Italians, okay? Sometimes people think we're yelling and we're really not. We're just communicating. And so if it's louder than normal or it seems different, I'm probably going to say, hey, what gives? But one of the things, again, to go back to is, what do you do for you? Are you a reader? Are you somebody that needs to sit back and be quiet and maybe crochet or paint or listen to music? Are you a doer? Are you somebody who you relieve stress and anxiety by exercising, by cleaning, by going for a walk or a run or riding a bike or bouncing a ball? Are you somebody who needs a little bit of both? You know what? I need my space for 10 minutes, but then I have to come back to this and talk to you so that we can resolve it, so that I can feel okay. Or my anxiety and the story I create in my mind is going to cause further heightened anxiety, which means this is going to continue. So again, it's about being respectful, honest, and true about who you are and what you need without shame.
Very interesting.
So how do we maintain our spiritual connections?
Wow. That one has been a challenge. I know, and I have no shame in saying it. I truly 100% miss attending my church. And I have realized, although there would be times on Sundays I'd get up, well, we got to go to church. I have realized I really, it's community in a different sense. And so one of the things that we do is, I think it's important that we look at, who are those people that feed our soul? Who are those people that nurture our spirits? Who are those people that we feel that common bond and link with? And how do I continue to connect with them? Because right now, more than ever, I think we need that. I know that the majority, I would say 99.99999% of all the churches in our communities have found ways to stream church into your home. And yes, it's different turning it on a television or your phone or a computer and watching it, but it's better than nothing. Some churches have developed ways. I know at my parish, people can still do adoration. They've put the monstrance in the window. You can go and sit in the parking lot and have that quiet time in your car, listen to music, pray, whatever it is you need to do, while still looking at that symbolism for yourself. So it is different, but it still exists.
What about some healthy activities to boost wellness?
Oh, boy. That can be pretty much what works for you. I'm an active person. So for me, what I miss is going to my yoga studio, even teaching yoga. But what I'm still doing is yoga in my own home. Yes, it's different because I really do like going and having that community with other people that are doing yoga or meditation. I have found myself walking more than ever. And what I mean by that is I did not make it shamefully. I did not make it a practice every day to go to one of our parks. And there are plentiful around Stark County. We have some beautiful parks. And since the pandemic, I've been to the Gervasi Walking Trail. I've been to the Monument. I've been to Sippo. I've been to Tam O'Shanter. I've walked my neighborhood and seen things and I've lived here 20 plus years. It's like, oh, wow, I didn't even know this street existed. So, those are blessings. But we need to do those things. And again, to stay healthy, activity is keen. It's not just saying, oh, I'm not arguing and fighting, or I'm monitoring what I eat. We need that physical activity. There is a huge connection between physical activity and mental well-being. And physical activity can be anything that gets you up and moving within your own physical limitations. In other words, don't do anything the doctor says don't do. But if you have no restrictions on ambulation, then get up and walk, even if it's up and down your driveway, because you don't want to go too far by yourself. It's movement. If you can't get outside, maybe you have asthma and this is not a good time for that. Walk in your home. If you have steps, do a couple of the steps. But there are many, many ways to get your body physically up and moving, and it's crucial to our physical and mental well-being.
So get up every morning, get dressed, shave.
Yes. Oh, my gosh, yeah. One of the things you have to, steer against, it's real easy. I'm not going anywhere. It's easy for me to get up and just stay in my PJs. No, I keep my routine as close as I can. Not going to tell you I have not deviated some, but for the most part, no. And the reason for me personally, I know we're going to eventually go back to leaving my home and going to my regular job. And I don't want to create a new habit that I'm going to have to break. So for me, it does me good physically and mentally to get up, get dressed, have my cup of coffee, get my day ready, and then go. And I've designated a little small space in my home. This is my school office. I physically go to that. When I turn it on, I'm at work, and I function as though I'm at work. So that helps me. That may not be for everybody else, but it's a routine that does help me, is to get up, get dressed, get moving.
Okay. Our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The Half Off and Out by Store in Louisville is open. That's right, it's open, and it is really open. Usual hours, we've stocked up with necessary paper products, cough cold, vitamins, and many other healthcare products. We have a very safe environment with hand sanitizer and wipes for use at our entrance. And we also have a new acrylic screen to protect you at our cash register. We think we can fill most of your healthcare needs also, and our Medicine Center pharmacies all have efficient drive-through services for prescriptions and additional healthcare products. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. Thanks for joining us today. Brad?
We should touch on depression during the pandemic. You know, there's people that have struggles during normal times, and I'm sure this is extra stress, Margaret. So what tips do you have for patients or people that maybe need some extra help and we can't exactly see it in their eyes?
Right. And so, and that's a question, believe me, I have been emailed that since the pandemic is, you know, what about the increase in depression or suicidal tendencies? And you know, we're not going to tell you that, no, that's not going to happen. Resources are definitely available. And yes, it's very easy to see how and why we could see a spike in this. Services are different. Some folks aren't aware that services still exist, which is why this was a great forum to put it out there. Again, we have, for our folks that we see an increase in, you know, or from our families that are fearful of, you know, is there an increase in suicidal tendency, or so-and-so said, you know, I'm feeling this way, or they've emailed a teacher and said, this is my thought process. Again, we always have the resources. We're blessed in Perry. We utilize our school resource officers to do well checks. We also can utilize Coleman Crisis that's available 24/7. And again, to put their phone number out there, 330-452-6000. Our kids and adults can text for help, 741-741, and get a person right now that they can go back and forth and dialogue with. Coleman Crisis, the mobile response unit, will send within, 24 hours. There are so many licensed professionals that will show up to your home. And it can be anything from they're feeling overly angry, the behaviors have changed, they're expressing concern. You pick up the phone and call, and within minutes, there's going to be a licensed professional at the home to try to see and assess what's going on, and then follow the same protocol we would if we were in brick and mortar. And that may be, we recommend let's go to the hospital, we recommend further assessment, or let's try some things here and let us connect you to a counselor. So, yes, we absolutely can see, you know, that there could be an increase. Just because we're in the scenario we're in now does not mean there will be. However, folks need to know the resources that continue to be available to them.
You know, I've watched more news lately than I've watched in a long time.
Yeah.
There's no mention. I haven't heard any mention about this depression issue in the home and with everybody being kind of basically locked in and not able to go anywhere. So what do you think's happening?
You know, I think there's a couple things, and I know Governor DeWine mentioned it the other day. And, you know, one of the things we tell people to keep depression down and to keep things, you know, functioning is you just said it, Paul, you don't normally watch the news, okay, but you've watched it more now. And part of that's by design. We're in our homes, and what else is there to do but maybe flip a switch? And one of the things that can cause an increase into depression is overwatching the news, because we all know the news, you don't turn it on and it's not, you know, balloons and unicorns and rainbows. It's all the negative, everything wrong with the world and wrong with people. And it's like, oh my gosh, and now I can't go outside of my doors, but inside my doors, I'm looking at this box that's telling me there's this, and this. Dr. Acton for the state of Ohio had, you know, mentioned this on a couple of her talks is that we needed to be mindful of, as has Governor DeWine, and they have brought on some experts in the area of mental health saying, listen, it's not necessarily that we're not hearing it or seeing it. We have less eyes on people right now. So we're not necessarily knowing it to make a report or to call. And so what we tell families is, you know your student, and right now, aside of the transition, are there behaviors or things you're seeing that are beyond what you would expect? I mean, these go above and beyond. That's when we need to make that call. And if you are unsure, pick up the phone and call that mobile crisis response unit. Let them come out and be that extra set of eyes and ears that have no investment. They don't know. So they're coming out as a third-party observer, seeing, hearing, talking, and connecting to say, yes, here we have this scenario. And it is harder because we don't have the luxury of seeing. We really do have to go with what's being translated, which, again, goes back to a whole nother topic on communication via email.
Hey, Margaret, Margaret, how about we talk about You Matter campaign? We've got about a minute and a half, okay?
You know, again, that campaign, I love it. Started back with it a couple of years ago. We used it during another horrific time in our community when we had another, epidemic, if you will, going on. That was just, you wanted to see the community come together. They did. And one of the things that I found was AltCare does the You Matter campaign, and it's a connectedness. And what I love about that is right now, I think that could be our slogan for the entire world is, it shows the importance of community coming together. And it just radiates that each and every member of the community, whether you're a student, a parent, a teacher, an educator, a doctor, a pharmacist, the person stocking the shelves, the greeter at Walmart, the first responders, every single one of us is an integral part of the system, and you matter. And if any one of those parts is not there, not available, feeling broken, not a link in that chain, the system does not work. And so when you say, or you radiate and look at You Matter, I don't think there could be a more truer statement. And I think we're seeing that in spades. Teachers going to the end of the earth to make the lesson they're putting out there, having substance to it so kids know you matter. You might be there and we're here, and guess what? We're still connected. Doctors doing teleconferencing. They didn't shut down and say, yeah, we're not going to see you for 6 months. No, let me try to connect with you this way. Our hospitals doing screenings, even if it's, out in that parking lot first, again, to keep every single member entering that facility, to include staff, safe. You matter. And I don't know. To me, it's just so positive because it's a wonderful message for any person we come in contact with, is to say, you know what, if no one's told you today, I'm going to tell you, you matter. And I'm glad you're here.
Very interesting. So I think we're about out of time here, aren't we, Brad?
Yeah, we are close. So, Margaret, we appreciate you being here today and sharing with the community. Thank you for all you do.
Well, thank you for having me, and stay healthy, stay safe, and stay put.
Thank you very much, Margaret. We enjoyed it. I think this is the most useful program we've had in a long time.
Wow, thank you.
A lot of people listening. So, Margaret DeLillo Story, clinical counselor, mental health counselor for Perry Schools. We'd like to remind our listeners, if you have a medical issue, please take it to your professional. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank you for listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again, hopefully next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy.